My name is Sky Mayo. I am a surgical oncologist at the OHSU Knight Cancer Institute in Portland, Oregon. We are honored to present our paper, Hepatectomy is associated with improved oncologic outcomes in recurrent colorectal liver metastasis, a propensity-matched analysis. I also want to acknowledge Thomas Sutton and Liam Wong for their work on this project, and my former clinical partner, Kevin Billingsley, whose expertise during his time at OHSU forms the backbone of this research. Hepatic resection, when possible, remains the standard of care for patients with colorectal liver metastasis and offers the best chance at long-term cure, reported at upwards of 20% at 10 years in modern series. Given the high risk of recurrent disease in the liver and the unclear benefit of additional chemotherapy, we sought to investigate if repeat hepatic resection is associated with improved post-recurrent survival as compared to chemotherapy alone. We reviewed our data identifying patients treated with an initial liver resection, finding 44% experienced a hepatic recurrence at a median of 10 months. To balance the two heterogeneous groups, we used propensity score matching. We found that repeat liver resection was independently associated with improved post-recurrence overall survival and recurrence-free survival compared to chemotherapy alone. Furthermore, more than 3 liver lesions at recurrence or radiographic recurrence less than 12 months were independently associated with shorter survival. In this small cohort, there was a modest 6-month overall survival difference that was in stark contrast to the median progression-free survival of 66 months compared to 13 months for repeat resection versus palliative chemotherapy. Propensity modeling is a valid, but albeit an imperfect attempt to address our question. It is no substitute for a randomized clinical trial. At its essence, our research suggests the first recurrence after resection is itself a harbinger of disease biology, ultimately forecasting outcome. At OHSU Knight, patients with technically resectable hepatic recurrence are either considered candidates for upfront repeat resection or biologically tested with chemotherapy prior to consideration for a repeat resection or for a suite of liver-directed therapies. Patient-reported outcome measures capturing data such as the time toxicity of chemotherapy, chemotherapy-free survival, and the cumulative side effects associated with systemic treatment deserve attention. These considerations are essential for a disease where there are now 2 randomized trials without an overall survival benefit of adding chemotherapy for patients with resectable disease, and the need to thoughtfully balance the quality of life impact of additional chemotherapy. Finally, our data underscore the importance of including an HPB surgical oncologist as part of the multidisciplinary team at diagnosis and at the time of disease recurrence. Thank you for the opportunity to share our work from the Knight Cancer Institute at Oregon Health and Science University.